Happy Friday. Dr. Aimee Ostick here with Health and Healing Direct Primary Care in Woodland Hills.
I'm Dr. Brian Ostick. I'm an ER doctor in Woodland Hills, California.
And he is my guest on Friday's 5-minute review on all things COVID for now. Hopefully we'll resume some other health-related topics at a later date. We're wrapping up the 8th week of safer at home orders here in LA County. And today actually is when they will start to be going into the second phase of reopening, which is pretty limited and varies by county. And so some retail shops will have some limited hours and opening. And so it's exciting news. Beaches and parks will be open for people to get outside. But still, a lot of restrictions are necessary, precautions to be taken so we don't see a huge uptick in cases.
Right, we're excited to open up, but we want to be careful about how we do it and make sure that we're doing it in the right way. We've been good so far about opening up slowly or social isolating, and therefore we've had less volume in the ER over the last month than we expected. So that was a great thing. But the worry from us in the emergency department is that when we open back up and people start interacting with each other, that the virus will spread very quickly again, and that we will see that bump. But we're hoping that we do it in an evidence-based way so that as we open up in phases, and that we don't see that huge spike.
Right, and then if we do it in a phased approach and we start to see a slow increase, that we could reel back maybe.
Right.
And really all this means is that we have capacity. It doesn't mean the virus really went anywhere. It doesn't mean we really are much safer in terms of, transmissibility. It just means we have capacity now in our ICUs and our ER to take care of those that need to be taken care of.
Right, currently in our hospital, we have the ability to admit you to the hospital. We have a bed available, and if you need a ventilator, we have the ventilator for you. But if we got to a point where that spike really happened quickly, that's when you get worried about not having enough ICU beds, not having enough ventilators.
Right. And because of the great job that LA County specifically, government-wise and also resident-wise, has done with social distancing, and the great job you all have done with maintaining these orders, it has really slowed our growth in terms of cases and death. There starts to be this feeling of sort of, what are we doing this for? We're not seeing the crazy numbers, and there's this is what's hard about preventative medicine, and I deal with this all day long because that's my specialty, right? I convince people to get the colonoscopy, which seems like an invasive procedure for prevention, to prevent something. I put people on high blood pressure medication, which is an asymptomatic diagnosis, really for prevention. It's treatment, but it's to prevent cardiovascular disease. Brian, you're in like the sexier arena where you get to kind of treat people and intervene when they're at their most vulnerable and critical state.
Right.
So,
we're not seeing though the heart attacks and the strokes to the level that we were before, and there is a concern that people are medically isolating at home, which would be different than self-isolating. And so we want to say to everybody, if you have a medical emergency, you can come to the emergency department. We are open, we're available. We will treat you appropriately and make sure that if you don't have COVID, that you're in the non-COVID area, and that if you're worried about COVID, that we have you in the COVID area. We can keep you safe and treat your medical emergency.
Absolutely. Medical isolation is a big concern. I think it's okay to live in this gray area of being both concerned about the virus spreading and also the sequelae of being shut down and people medically isolating, and maybe a delayed diagnosis of cancers, maybe not treating the strokes at an early time frame like we should be. But what I want to talk to you really quickly about today is when we start to feel unsettled, like what are we doing this for, is the prevention part of it. Is we start to think, well, maybe it's not as bad as people are saying it is, and maybe it's really something else, or maybe there's others, intentionality or an agenda that people have behind the scenes.
There's a lot of conspiracy theories out there.
There's a lot of conspiracies, and it's hard because, and people are, everybody is worried, and we're all coming from that same sense of worry. And I want to just put that out there. I had this conversation with parents with vaccines all day, is we're all just want to do the best thing for our kids and to do the best thing for our health and for our parents. So I thought it'd be fun to just play a little most common conspiracy theories out here. This comes straight from the Cornell Alliance for Science. Cornell.
Ever heard of it?
Never heard of it. Is a great university. They've been tasked. They have a great department that helps sort of demystify and debunk a lot of conspiracy theories out there about specifically medicine, but also environment, things like global warming conspiracies. So, and their aim also is to drive away the clickbait, not to just keep reposting these YouTube videos and then they get higher and higher up on that queue and it starts to fuel concern and worry where there really shouldn't be. This is a great little summary. I'm going to start with the first one. Dr. Ostick.
Yes.
The 5G conspiracy.
5G.
Right.
So they're saying that the 5G iPhone system out there is causing the coronavirus.
Yes. That's what Woody Harrelson says.
Woody Harrelson. Woody, what are you smoking at home? I don't know where that comes from. That is not how viruses start or spread. So 5G causing the coronavirus? No.
No, zero. So viruses cannot travel on mobile networks. It's physically impossible. The WHO has put that out there. And what the concern is that this has led to is people burning down 5G cell towers in all over the countries, and then you're getting into a whole host of other issues. So
give me my 5G.
Yeah, Bill Gates, you think he started it all?
Bill
you think
Gates,
he's got some skin in the game?
Bill is one of the biggest philanthropists and proponent of public health in the world that I think we have. That's a public figure that's one of the most wealthy people in the world pushing for better health. And so for him to be the person behind starting the COVID-19 outbreak, I think seems like a conspiracy.
A lot of misinformation about that. I think there was some videos of him kind of warning us all about a future pandemic because he does have his, he is kind of boots on the ground with things like Ebola outbreaks in Africa, malaria. So he sees that potential. But no, he did not have any role in starting this pandemic.
No.
But there's several here. Where do you think? Do you think it came from China? Do you think they made it in a Chinese lab?
So this one has
weapon?
gotten more airtime than I've seen. Is that it was the Chinese created it. It was in response to Donald Trump, who put the economic barriers on them, and it was causing this trade war with China. And because of that, they started it and wanted to infect us. I think that's conspiracy.
Yeah, and you would be right. There have been several articles showing evidence, good strong evidence that there is this is a natural leap from from zoonotic origin, meaning animal origin, to humans, and that the backbone of this virus very much has its roots in animals and in zoonotic origin. So there really, as much as that would be a fun story, there's really no good evidence of that this far.
Right. That sounds more to me like people pushing political agendas.
Of course, right. So what about GMOs? Do you think GMOs are to blame for all of this?
I think GMOs are there to make our apples big and delicious. And I do not believe that GMOs have anything to do with causing the coronavirus outbreak.
What's interesting is that term genetically modified organism is a very broad term, right? Similar to like something called organic is a very broad term. Something organic means it has basically carbon in it, which is most of everything that's living. So vaccines will very much be derived from some sort of genetically modified organism. And so GMOs will actually, ironically, have a role in curing this virus and showing and giving us a vaccine. So be careful how we all use that word GMO. They're not all bad. Absolutely not. They very much have enabled us to have sustainable food chain and food supply.
And the flu vaccine every year is made by incubating inside of eggs.
Mm-hmm. So that's really kind of what a genetically modified organism is. What about, do you think it doesn't even really exist, the COVID-19, that it's really just a plot, that it's really no worse than the flu, that this whole it's been just overstated?
No, I mean, I am taking care of patients in the emergency department every day that have the COVID virus and the COVID virus infection. Now, there are varying disease states within COVID. I mean, I see the people that come in that are young and otherwise healthy and have fever and cough and are doing okay and their oxygen level's fine and their vital signs are okay. And those people get discharged from the emergency department. We don't even admit them to the hospital. But I've seen the other side too of patients who come in extremely hypoxic, which is low oxygen, that need to be put on ventilators, that end up unfortunately dying very quickly after they're admitted to the hospital because of the COVID virus. So it does seem like it's more transmissible than flu. It does seem to be more virulent than flu in terms of people dying more quickly and faster from flu and at greater rates.
Right.
At least that's been my experience in our emergency department. Now that has to do with people who are older, usually have comorbidities, meaning high blood pressure, obesity, diabetes, those sorts of things. And so those patients are definitely at higher risk of having the more aggressive variation of this COVID infection.
COVID-19, sure. Absolutely. I think we don't know yet what this mortality rate will be. As we start to test more people and have a better understanding of the spectrum of disease, we can better safely say, but even best case scenario, it's still probably 6 to 7 to 10 times worse than a seasonal flu mortality, which is bad. Yeah. How about that pandemic is being manipulated by the deep state, and that Dr. Fauci, the face of the U.S. coronavirus pandemic, is a secret member?
Anytime you say the words deep state, I feel like you're already in conspiracy theory territory. And Dr. Fauci is a renowned doctor who has been involved with many different outbreaks of different infections over the years. I think he served under 6 U.S. presidents or so, which is just amazing. And so the fact that he would be involved in this outbreak and not the person fighting to make the U.S. Better from this outbreak, I think is conspiracy.
Right. I think this is kind of also where they get with like that pandemic video, which I watched 2 minutes of and just smelled the crazy right away. I think there's just a lot of danger in spreading that type of misinformation, and that's kind of why we're doing this. We usually don't engage in that. I think we can kind of smell it for what it is, but we also have to actively fight down the misinformation out there.
Sure.
What about the last one I'll just say is that the death rates, that people, are you getting paid every time you put COVID-19 on the #1 diagnosis of your death certificate?
No, there's been no discussion from, I've heard the AMA pushing that as a conspiracy, or that hospital administration is telling us, and there's been none of that. Now, I mean, the COVID infection is around, and in Los Angeles, it's probably more prevalent than in other places across the country. So we are seeing a lot of COVID, and yes, I'm making the diagnosis of COVID infection in a lot of patients, much more so than I did a month ago, and obviously more than I did 6 months ago before the COVID outbreak was even a thing. And so, we are diagnosing it more, but that's because it's out there.
Yeah, and if somebody comes in with a heart attack and they happen to have COVID, it's actually related. It's not an unrelated phenomenon. Pathophysiology tells us very much so that when you get infected with the virus, there is a rapid inflammatory response, and that very much could destabilize. Getting back to COVID-19 diagnoses on death certificates, so it's very much related even when people aren't coming with classic symptoms. So if they're coming with a heart attack or stroke, DKA, which is diabetic ketoacidosis, and also have COVID, it is very much related, and we need to be recording that so that we can better understand this disease process. So if anything, what we're seeing, I think we are underreporting the death rates, and we probably will go back and do postmortem testing on people to see if maybe what they had was COVID all along. There's sudden deaths, there's been arrhythmias being reported, and then when they go back and they test people, they were actually positive for COVID-19. So it's very much related. Whether or not there's money on the table for it or not is not really relevant to the science world, which is what we're in, to better understand this disease.
Well, thanks, Dr. Ostick.
Thanks, Dr. Ostick.
It was a pleasure being on the show.
It's not a show yet.
Okay.
Dr. Aimee Ostick here, Health and Healing Direct Primary Care,
Dr. Brian Ostick, Valley Presbyterian Emergency Department.
Thanks, guys. Have a
Thanks.
wonderful weekend.